Hello and welcome to another Advanced Rheumatology Catching Up on the Couch. I am your host, Christine Matelan, and today's topic is Medicare Open Enrollment for the benefit year 2023. I am joined by two gentlemen from Bankers Life, Shaine Black.
Thank you.
Welcome. Shaine is a Bankers Life insurance agent, and Damien Granda is a unit field trainer and an insurance agent for Bankers Life.
Thank you for having us.
You're so welcome. We're glad that you're here. So, Damien, can you take my audience through the Medicare alphabet, please?
Absolutely. So there's 4 parts to your Medicare that you need to be aware of, and it's the alphabet we're talking about. So the first part is Part A. Part A is free for most people when you turn 65, as long as you worked 40 quarters or a spouse who worked 40 quarters. Part B is your doctor coverage, and that is the part that you see a premium coming out of your Social Security. This year, that premium has actually went down to $164.90 from $170.10. And your Part B deductible, has actually went down to $226 from $233 it was last year.
Okay, good.
Your Part C is your private insurance, which actually goes along with original Medicare. That was Parts A and B. So that helps pick up what Medicare actually leaves behind. And your Part D is your prescription coverage. So some of the things I make sure folks are aware of with their prescription coverage is the highest deductible a plan can have this year is $505. And everyone always questions the donut hole, if they're going to hit it and what it looks like. The donut hole is actually calculated based on retail cost, not what you pay out of your pocket. So the donut hole actually happens when the retail cost of your prescriptions for the year end up being $4,660. When you're in the donut hole, your prescription cost to you actually goes up, but they do have catastrophic coverage. When those retail prices reach $7,050, the cost actually drops back down for you.
Okay. Just a quick question. So generally, the donut hole is for Advantage plans, or does traditional Medicare fall into a donut hole sometimes as well?
Actually under both, because it's your prescription coverage is where the donut hole impacts people. So under original Medicare and under Advantage plans, you have prescription coverage. So both are susceptible to the donut hole.
Okay. Good to know. So, Shaine, let's talk about the enrollment period. So the enrollment period is coming up on October 15th.
Yes.
And ends December 7th.
Yes. Actually, when it comes to the open enrollment period, there's multiple different kinds of enrollment periods that are available during Medicare, other than the annual election period that we're currently coming up on here in October. You have your initial enrollment period, which is whenever you turn 65, and it's 3 months before, the month of, and 3 months after, whenever you have turned the age of 65. You have anytime after you have 24 months of disability, you can also enroll then, as well as you can postpone it for a little bit of time, though, as long as you have credible coverage through your work insurance. Then next thing, obviously, you have the annual election period. And then special enrollments are things such as whenever you move to a different county, any type of maneuver alcohol. So any type of like state lines, etc., you get another special enrollment period or initial enrollment. And then in the open enrollment, which is January 1st to the 31st, that is whenever you get a chance to finally change your plans up a bit, though. So if you want to basically go back to regular Medicare or change between different providers, you have the option to at that time period.
So, Damien, you mentioned as long as you work 44 quarters, you qualify for Medicare. What about a wife that was always a homemaker, never had a job?
Yeah, so fortunately, she gets the same treatment because her spouse would have worked 40 quarters.
Okay.
So you can earn eligibility through a spouse.
Okay. So let's talk about the types of Medicare, because there's supplemental plans, there's Medigap policies. Most of our patients have Advantage plans.
Mm-hmm.
Some actually have traditional Medicare with a supplement and then a separate pharmacy benefit.
Right.
And those types of plans with the drugs that we use, a lot of our infusibles, it's less costly to the patient to have Medicare Part B with a supplement than to have an Advantage plan.
Right. So the first type of Medicare a lot of folks use, and like you mentioned, is a Medigap policy, also called a Medicare supplement. So that's a true insurance that picks up, it falls secondary to original Medicare. So their Medicare will pay, and then the insurance company would pay with their supplement. And as you mentioned, they have a separate prescription plan.
Right.
So the good part about that is a lot of people's health care can stay the same year to year if they like it, but as prescription needs change year to year, they can shop just the prescription part.
Okay.
The other part of Medicare, like you mentioned, was a Medicare Advantage plan. With those plans, their health care and prescription plan all falls under one card or one umbrella, if you will. And like you did mention, some of those plans, it's harder to shop around for the more specialty drugs like infusions and things.
And what if people are still employed at the age of 65? They automatically enroll in Medicare Part A, correct?
Yes.
But they can defer Medicare Part B up until what age?
The good part about it is there's no age as long as they have credible coverage. So if they are still working, you have the option to delay your Part B. So you don't have to go on any of these Medigap or Medicare Advantage plans, but you have to make sure you have a credible coverage. That way you're not incurring any penalties.
Okay. And with commercial coverage, generally, patients are allowed to take advantage of copay programs through the manufacturer. Is this still available to someone 67 on a commercial plan?
I believe so. And the good part is I believe they're still allowed to use those assistance programs, but there's a lot of other assistance programs too, specifically for retirees. So there's a lot of options out there. You just got to know where to look.
Okay. So, Shaine, patients show up at our office, and each visit they, get a little perturbed with us sometimes because we ask for all of their insurance cards at each visit because things change, and they could have insurance ABC and they switch from a PPO to an HMO with insurance company ABC. And so in their minds, they still have coverage through insurance ABC, but now they have a new card with a new ID number and a new group number on it. So we need to update our files, otherwise that claim's going to get kicked out. So when they show up at any office, what card should they present to the reception window?
So that is a great question, and I feel like a lot of people and clients that we work with often run into the same exact issue, though, where they have the same question, I should say. So what happens is whenever you get a supplemental plan of any kind, though, you'll have 3 cards that have to show up at the very reception area that you said of check-in, and if you have an Advantage plan, it'll be 1 card, though. So just to kind of refer back to that, though, for a supplement, you'll have 3 cards. They're red, white, and blue card, which will be as soon as you get on to Part A. You'll have your supplemental card, which will be the insurance covered by your provider, and then your third card, which is going to be your drug coverage card, though. So you'll have separate things to show to your pharmacist, your doctor, and everything in between. And then with an Advantage plan, it wraps that all into one, though, and it covers basically your RX or whatever it may be, such as your drug coverage, your medical coverage, hospital. All of that's just one card that you show them. And that'll basically get them through the entire thing, as well as Advantage plans can also do things such as if they go into dental, hearing, all that, they can also cover those things as well, whereas supplements don't often provide.
Okay. On our website, on our resource page, we have a listing of different foundations for financial assistance. Unfortunately, since the pandemic, a lot of these foundations are underfunded right now for most conditions that we treat in our office, but they may have assistance for your spouse or your significant other or a child that has other diseases. So it's always good to check at least once a month and sign up for any alerts when money is deposited into those funds. It goes very quickly. It opens every January 1st. We keep a list of patients that we know are truly in need of it, and we have one particular person in our office that immediately on January 2nd comes in and starts checking those websites. Now, there's also additional resources with PACE and PACEnet, correct, gentlemen?
Yes, ma'am.
And are those good things for patients to look into? I know that Back when I started with the practice, the PACE and PACE-Net applications were very lengthy, and patients were, very hesitant to fill them out and give so much financial information, but it really can be beneficial.
Absolutely. So Shaine and myself being retirement professionals, we talked to a lot of people about it. And the good news is that it's actually gotten a little bit easier to put in an application. It all can be done over the phone. So they have made the application a little bit easier. And even at that, I know some people are still hesitant over the phone, but I always advise that extra savings on some of these costly prescriptions can really just change people's livelihoods. So definitely think it's worth it.
Okay, so obviously you want to understand your enrollment options, and both Shaine and Damien can help you move forward with that and give you assistance and guidance based on your own health and what medications that you're currently on or that your spouse is currently on. In a married couple, one of the spouses may only be on a blood pressure pill, and an Advantage plan might work perfectly for them, but the other spouse may have more disease-driven conditions that require expensive medications. And it's good to make sure that you know the cost of these medications before you enroll in that plan, because once you enroll in that plan for the year, you can't change your mind until the following year, or...
Right. So a lot of times people are locked into a plan. And just like you mentioned, it's not cookie cutter. So everyone has different Medicare needs. And that's why we have a lot of great providers here in Pittsburgh. However, they do have one election period coming up here in January through March. And they call it the open enrollment period. So if you do switch a plan and find that you didn't have enough time to do enough research, they give you one more time to check, but it's only a one-time look. So you can make one more change at the beginning of the year, but then you're locked in for the year.
So, Damien, we do have some snowbirds that go to Florida, Arizona, go and stay with their children, for 6 months out of the year. How do Advantage plans affect them going across state lines?
Yes, so for those that want to escape the shoveling of snow, it's important to know what type of Advantage plan you have and if it'll work in both locations. So there are HMOs versus PPOs. An HMO has in-network coverage but no out-of-network coverage. So if they were to go outside of a service area or a doctor wouldn't take it down in Florida, they have no coverage, so they're paying all of the costs out of pocket. Whereas there are PPOs, which have their in-network coverage, but also an out-of-network cost share. So that way, even if they can't find a doctor that's in-network, they're still not responsible for 100% of the cost.
So that is a very important thing to talk to any broker.
Absolutely.
If you plan on doing that or if you currently do that. No one likes to get stuck with high cost of healthcare right now.
Absolutely.
And, God forbid someone winds up in the emergency room, they don't need to get an enormous bill after they get discharged.
And the good news, even with HMOs, so the more local networks, the emergency room cost is the United States wide. So it's the same here as it would be in California. So if you're just traveling for fun, traveling to visit family for a month or so, and you have a fall, you don't have to worry about going to an emergency room with a crazy out-of-pocket cost. It'll be the same as it was here. But I definitely advise if you have trusted doctors where you spend 6 months down in Florida, you want to make sure you see that doctor while you're down there for a checkup or anything. Definitely looking at the option of a PPO is probably a good conversation to have.
Okay. And what about transportation to hospitals? Does any insurance cover ambulance service?
Yes, so that will depend on the plan. I know Original Medicare will help with that cost under the supplements, but so do the Advantage plans. And it's just important to read through your benefits coverage on what that cost share is.
Okay, and your benefit guide generally is rather thick.
Yes, it is. I typically tell folks I'm pretty good at putting on one sheet of paper, so it's a little easier to understand. So definitely talking to someone that understands the lingo helps out.
So you want to make sure that you plan to enroll on time to avoid penalties and delays in coverage. If you plan to enroll in your initial enrollment period, set a reminder for yourself 3 months before your 65th birthday. You want to compare your coverage plan options, calculate your costs per month, check your premiums, check your deductibles, check your copays and coinsurance. That's all part of your plan. Sometimes patients will receive a bill from us and they say, well, I have 3 insurances, somewhere that all should have been paid. There is coinsurance or copay on each of those insurances. You can enroll in Part A automatically, and you want to make sure you enroll in Part B or you get a penalty. And you want to make sure you confirm receipt of your Medicare cards.
Absolutely.
Okay. Make sure that if you are enrolling in an Advantage plan, that your current providers are in par with that insurance company. There are different, we'll say, pieces of the pie for each insurance company. Generally, the 2 big companies here in Pittsburgh have specific regulations that you must go to one of their facilities. You cannot go to a private facility such as ours. And some patients have made that mistake and changed over and not called to make sure that Dr. Black or Dr. Smith are in their network. That is a big thing that you want to remember to do. Check to make sure that your physician is in network. If you have a chronic condition where you've been seeing someone for years and years and years, the worst thing that you want to do for your own mental health is have to change to someone else. So that's a big one right there. You want to make sure you know what your prescription drug costs are, and that they are on your formulary. There's different levels of formulary that we did not touch upon. And does the plan include the pharmacy that you currently use? So you want to make sure that if you're currently getting your prescriptions through the mail, that will continue, and you want to make sure that you have a good quality rating on the insurance company that you choose. And again, both Shaine and Damien are going to give their information. They are available for you to reach out to them. They can talk to you by phone. They can meet you at a coffee shop. They'll make it work for you. And a good consultation is, the best way to move forward. And we all sit down and, watch college football or, Gunsmoke or whatever it may be, whatever your choice is to sit down on a Saturday afternoon. Now is the time of year where you're going to start seeing a lot of commercials for a lot of different plans. And if it's something that piques your interest, you should write it down and discuss it with these gentlemen first. I'm not saying that they're not reliable companies, but they can be very confusing when one of your favorite actors or favorite athletes is talking to you about, buying red, white, and blue insurance or whatever it may be. So we take care of our patients like family here, and we just want you to be protected and make sure that you're getting what you're paying for.
Absolutely.
So in closing, Shaine, do you want to give your information, either phone number or email?
Absolutely, yeah. So the way to reach out to me specifically, though, would be shane.black@bankerslife.com, as well as my number is 412-282-6010, and just leave a message if I don't get a hold of you.
And Shaine, you have a unique spelling of your name as well.
Yes. So my email is Damien, DAMIEN, .Granda, GRANDA, @bankerslife.com. Best to reach me on the phone, though, 412-282-6056.
Okay. Well, thank you, gentlemen. Any last words?
I just would agree with
a
you.
busy season for you.
Very busy, and I would definitely say 20 minutes talking to a professional like Shaine or myself is worth the peace of mind knowing there's no curveballs coming in one's healthcare.
Okay. And also, if you have an appointment coming up, both Shaine and Damien have left their business cards. You can ask a provider if you need some help making changes. You may have been stable just on oral medications this past year, but you and your provider decide that you're going to go on an injectable or an infusible medication. This may be the time to decide whether or not you want to make that switch over. And also, flu season is upon us, and upon your visit with your provider, we do have both the low dose and high dose, which is the over 65, flu shots available. So once again, I want to thank you and Shaine and Damien for joining us for another episode of Catching Up on the Couch. We'll see you again soon. Stay healthy, check with these gentlemen, and get your flu shot.